One of the biggest frustrations for new moms is often breastfeeding. And it seems a little counterintuitive because you would think, well, breastfeeding is the most natural thing in the world. I should be able to just take my newborn baby, put it on my breast, and everything gets done. But it's actually not as simple as that. And breastfeeding takes a little bit of skill. There's a learning curve for mom. There's also a learning curve for baby. So it's good to talk about some of these things, to go through some of the things about breastfeeding to help you with this transition and to make it a little bit easier. Breastfeeding has big advantages. It's big advantages to the mom, and there's big advantages to the baby. For the baby, there's been all kinds of developmental advantages shown with breastfeeding. There's certainly fewer infections, fewer ear infections, colds, that types of thing, because there is antibodies that comes over in the breast milk. But also for mom, breastfeeding can also be very helpful. It helps burn calories, it helps with bonding with the baby, and honestly, it's free. And formula can be very expensive, so that's another big advantage to breastfeeding. Also, once you get good at it, it's a lot less hassle. You don't have to mess with cleaning bottles. You don't have to worry, oh gee, we went out and I forgot to bring formula with me. You always have the breast milk with you. Now, one of the downsides about breastfeeding is that you basically always have to be with your baby in order to give the baby breast milk. That's not completely true because you can pump and have breast milk stored so that someone else can give the baby breast milk through a bottle. And breast milk stores very well in the freezer. And so that's something that can be done. And women can very successfully store breast milk and have it given when they're at work, for instance, or for a small trip if they go away. So those are some of the sort of big pictures about breastfeeding. Now, the breast milk doesn't come in immediately. It actually takes a few days to really come in. And in those first few days, what you make is something called colostrum, which really isn't full-on breast milk, but mostly just serum and antibodies. But it's what really the baby needs those first couple of days. Now, everyone's a little bit different. For some people, it's dramatic. The breast milk comes in, boom, there it's in. Other people, it's a little bit more subtle. But usually, the second or third day, the breast milk really starts coming in and really starts flowing. And then the baby is going to get more and more breast milk. Getting through those first couple of days can be a little frustrating because not so much is necessarily produced. It's recommended, if possible, to try to breastfeed the baby for the first year of life. But any amount is great. So even if you only get 6 weeks worth of breastfeeding in, you've given your baby a lot of benefit. So don't beat yourself up if you can't do it for a whole year or a whole 6 months or any arbitrary length of time. You need to see what's comfortable for you. The other thing is, unfortunately, some people treat moms like criminals if they're not going to breastfeed their baby, and that's just ridiculous. So there are definitely advantages to breastfeeding, but you're not a bad mother if for some reason you can't breastfeed or you decide not to. Babies can do fine on formula. I was a formula baby. Boy, just think about how wonderful I could have been if I was breastfed, right? So you're not a criminal if you decide not to breastfeed. Don't feel bad or guilty about it. It's totally up to you. But breastfeeding does have some nice advantages for both you and your baby, and so it's something that you might want to consider.